Cambridge International A2 Level Psychology. Impulse control disorders and non-substance addictive disorder.
Impulse control disorders and non-substance addictive disorder. Characteristics. Definitions. Griffiths 2005. According to Griffiths, there are six components to any addiction disorder: salience, euphoria or mood modification, tolerance, withdrawal, conflict, internal conflict, relapse. Types: kleptomania, pyromania, Burton et al. 2012, gambling disorder, Myers Kleptomania Symptom Assessment Scale (KSAS), evaluation of KSAS, test retest reliability response bias as it is a self-report quantitative data. Definitions. Griffiths 2005 ICDs are characterized by failure to resist temptation or urge or impulse. Individuals find it difficult to regulate thoughts connected to a certain behavior. According to Griffiths, there are six components to any addiction disorder: salience, the addiction becomes the single most important activity in their life. It dominates their thoughts, feeling, and behavior. Euphoria, the addictive behavior creates mood modification, feelings of being high or escape and peace. Tolerance, gradually the person has to do more of addictive behavior to get the same effect. Withdrawal, unpleasant feeling or physical effects faced when the behavior is reduced or stopped. Conflict can occur between the person with and surrounding. They may compromise their personal relationships, work, education, or other social activities. They may face internal conflict when they are unable to stop the addiction despite wanting to relapse, the change of returning to addictive behavior despite reduction efforts. Types: 1. Kleptomania, 2. Pyromania, Burton et al. 2012, 3. Gambling disorder. 1. Kleptomania, an impulse control disorder that involves an urge to steal. The items are not needed for personal use or monetary gain. The more difficult the challenge of gaining the objects, the more thrilling and addictive it becomes. It is characterized by intrusive thoughts and urges to steal. More women seem to have the disorder, perhaps because they are more likely to seek treatment. Occurs between 0.3 and 0.6% of the population, and they are diagnosed with other disorders such as anxiety and substance misuse. Can lead to arrest, prosecution, embarrassment, and loss of employment. 2. Pyromania, Burton et al. 2012, an impulse control disorder characterized by an impulse to start fires and deliberately doing so on more than one occasion. These individuals are fascinated with fires as accelerants, etc. They feel a sense of satisfaction and arousal once the fire has started. Some pyromaniacs are indifferent to the destructive consequences, however, some report feelings of severe distress. Note: both pyromaniacs and kleptomaniacs may feel tension before the act, then gratification afterwards. 3. Gambling disorder, a non-substance addictive disorder that is characterized by constant and troubled gambling behavior, difficulty withdrawing even if big money is lost, lying to conceal involvement with gambling, and loss of significant relationships. Gambling is shown to activate the brain's reward system in a way that is similar to substance abuse. Myers Kleptomania Symptom Assessment Scale (KSAS), 11-item self-rated scale which measures impulses, thoughts, feelings, and behaviors related to stealing in last 7 days. Each item is rated on a 0 to 4 or 0 to 5 point based scale. 0 is equal to no symptoms, 4 or 5 is equal to severe, frequent, or enduring symptoms. 1. If you had urges to steal during the past week, on average, how strong were your urges? Please circle the most appropriate number: 0, none; 1, mild; 2, moderate; 3 severe, 4 extreme. Explanation of case is high score on test retest reliability, good concurrent validity when compared to other validation tools such as global assessment of functioning scale, could have response bias as it is a self-report, provides quantitative data which makes it easy to compare to outcomes of interventions. Issues and debates relevant to everyday life can be used in monitoring symptoms to gain insight in patients' thoughts and feelings, to develop treatments and help persons with disorder to understand their behavior. Explanation 1. Biochemical dopamine, 2. Behavioral positive reinforcement, 3. Cognitive feeling state theory, Miller 2010. 1. Biochemical dopamine, rewarding stimuli such as stealing or gambling stimulate reward centers and release dopamine. When behaviors become compulsive, you develop tolerance and levels of dopamine in striatum reduce. Striatum is responsible for the reward and behavior control. A deficiency of dopamine in the striatum leads to continuation of compulsions and addictions, increasing stealing behaviors. This is known as reward deficiency syndrome, Cummings and Plum 2000, and can be used to explain other forms of addiction. Kleptomania is a positive side effect of using synthetic dopamine for treatment of disorders such as Parkinson's. Evidence shows that symptoms of gambling disorder and compulsive shopping emerge alongside the use of dopamine drugs, proving relationships between dopamine and impulse control disorders. 2. Behavioral positive reinforcement. When you receive a reward for doing a certain activity, you tend to repeat the activity to achieve more reward. This is positive reinforcement. It occurs when learned behavior is a result of previous trials. For example, the enjoyment gained by winning in poker. Gamblers don't stop playing once they start losing because of schedules of reinforcement. Gamblers don't win every time they play and so don't feel 100% satisfied. Thus, they continue to play over and over, believing that playing just one more time will make up for the loss or lead to victory. This is partial reinforcement. 3. Cognitive feeling state theory, Miller 2010. Miller believes that the underlying thoughts and feeling states, thought sensations, and emotions a person experiences during an activity creates a state-dependent memory leading to impulse control disorder. Feeling states are created by an intense desire to do an activity, the positive experience associated with it, psychophysiological arousal, and the memory of the behavior. For example, pyromaniac who has feeling state I am powerful combined with positive emotions, physiological arousal, and memory of setting the fire leads to compulsions of fire setting behavior. Underlying negative thought or experience is the most likely cause of the feeling states that leads to impulse control disorders. For example, the pyromaniac who has the feeling state I am powerful when setting a fire may have underlying set of negative beliefs. For example, I am weak, making the act more intense and desirable. Further negative beliefs occur when behavior becomes out of control as gambling, stealing, etc. have negative consequences for the individual and those around. Not normal behaviors in moderation only become problematic because of fixated intense feeling states. Belief type example of belief. Negative belief about oneself or the world I am a loser. Positive belief created during event, for example gambling, I am a winner. Negative belief created from out of control behavior, I mess up everything. Issues and debates. Application to everyday life to treat addictive behaviors. Understanding growth of dopamine has led to biochemical treatments. Individual versus situational debate. Biochemical explanation relates to individual impairment of brain function. Cognitive explanation is more balanced. Natural experiences will be stimulating, rewarding, upsetting, but as individuals we develop our own feeling states in relation to the experiences, leading to overall change in patterns of behavior. Nature versus nurture debate. Behaviorist approach of positive reinforcement Skinner 1938 are based on nurture factors. Satisfaction gained from compulsive behavior in the environment reinforces subsequent behavior. Biological approach. Effect of dopamine uptake is based on nature factors. Treatment and management. Biochemical granted at 2008. Cognitive behavioral. Covert sensitization. Glover 2011. Imaginary desensitization. Lysinski and Nover 2003. Impulse control therapy. Miller 2010. Biochemical granted at 2008, research suggests that drugs like opiates, painkillers can be successful to treat gambling disorder. Sample to 84 participants, roughly equal split of both genders participated in a double-blind experiment. They were divided to take either a 16-week course of opiate nalmefene or the 18-week course of naltrexone, a placebo. Myers, Yale Brown Obsessive Compulsive YBOCS Scale to measure gambling severity, aim whether taking opiates would reduce gambling behavior, which was operationalized as A is bigger than or equal to 35% reduction in their YBOCS scores for at least 1 month after study. Note: participants' depression, anxiety, and psychological functioning were considered in their response to treatment. Results: opiate groups had significant reduction in gambling symptoms. Also, significant individual differences contributed to great reduction in YCBOCS scores. Participants with family history of alcoholism and those who received a higher dose of opiates showed greater reduction in symptoms. This suggests it's more effective in some addicts than others. Cognitive behavioral changing distortions in thoughts and feelings to enact behavioral changes. COVID sensitization Glover 2011 uses classical conditioning by combining an undesirable behavior with an unpleasant stimulus to change the behavior. Background in kleptomaniac study: a 56-year-old woman had a 14-year history of daily shoplifting without any purposeful gain, for example, stealing baby shoes despite not having anyone to give them to. Several compulsive thoughts occurred to her which were disgusting but hard to resist. Procedure of treatment: imagery of nausea and vomiting during the act of stealing. The woman underwent 4 sessions at 2 week intervals. For 2 weeks, muscle relaxation was used to enhance her ability to visualize. Muscle relaxation used to relieve tension from within the body and mind can be induced through medication, visualization exercises, or repetition of calming phrases. Progressive muscle relaxation is achieved through systematically tensing and relaxing the muscles of the body in turn. Increasing nausea visualization was used over each session. She imagined vomiting as she stole, which attracted attention and disgust from those around her. She practiced these visualization exercises as homework after each session. During the last session, she imagined the sickness going away as she walked away without shoplifting. At the 19-month checkup, she had decreased desire and avoidance of stealing with one relapse, along with improvements in self esteem and social life. Imagine desensitization. Lachinsky and Nover 2003 relies on the use of images to help individuals with impulse control disorders. First, a progressive muscle relaxation technique is taught, then clients visualize themselves in a triggering situation, for example, gambling venue, and are asked to think about acting on their impulse and all the psychological arousals associated with it. Finally, they have to mentally leave the situation while maintaining state of relaxation and not having acted upon the impulse. The sessions are often audio recorded to assist practicing outside therapy, found to be effective as it reduces the strength of a compulsive drive. This is done by reducing levels of psychological, physiological arousal associated by these disorders. In gambling, it was found to decrease arousal and anxiety levels associated with gambling impulses even at a 5-year follow up. Impulse control therapy Miller 2010 doesn't aim to eliminate behavior but to establish normal behavior. For example, compulsive shopper can still shop, but without triggering problematic behaviors that is overspending, hoarding, etc. It involves changing distorted thoughts about their behavior linked to feeling state explanation. First, the aspect of behavior that produces most intense feeling. The intense positive feeling itself and the physical sensations are all identified, measured on standardized scale known as the positive feeling scale for comparisons. The client is then asked to combine images of the compulsive act, positive feelings, and physical sensations, recreating the feeling state in their mind while performing eye movement desensitization and reprocessing EDMR exercises. EDMR individual recalls behavior or memories while the therapist directs eye movement patterns using hands or other stimuli. In between sessions, clients reevaluate their impulsive feelings using the feeling scale. Usually around 3 to 5 sessions are conducted alternating between visualization and eye movements until compulsive behavior is reduced. Case study of John, a compulsive gambler. After losing his first marriage, he got depressed because of the debt that was caused by gambling. With the help of his therapist, he identified his feeling state memory to be winning, which was connected to his compulsive behavior. After visualization and DDMR, he noticed a reduction in the urge to gamble as his behavior and feeling changed over the course of 4 sessions. During his follow-up interview, he stated that he is healthy now. Evaluation biochemical grant use double-blind trials, no researcher bias, increasing validity. Data collected was quantitative using objective data in the standardized YPOCS tool. Ethical issue as placebos were deceived participants. Cognitive behavioral Glover shows that covert sensitization can be used effectively to reduce symptoms of kleptomania, but it used a case study specifically for kleptomaniacs, which won't be generalizable to other impulse control disorders. The same goes for Miller, who also uses case study of John. In both cases, the following treatments occurred with a year post-treatment, which could check for relapse. However, the therapist is assessing the participants, which will make it biased. In-depth qualitative data obtained via case studies. Issues and debates applied to real life. Study by Grant et al. Showed effectiveness of opiates in treating gambling disorder. Also shows in what circumstances opiate will be most effectiveness. Cognitive behavioral treatments can be used alongside drug therapy or to improve the symptoms of those with treatment resistant impulse control disorders. Reductionist management of disorders are fairly reductionist, for example, use of opiate short effectiveness. However, it ignores the circumstances in a person's life, like the problem that triggered the disorder. Individual versus situational, cognitive, and behavioral approaches to treatment, like COVID sensitization, don't focus on the person's social and emotional situation. They rely on an individualistic approach. Don't forget to subscribe and hit the notification bell, new videos every day, and like this video, comment on it, and share this video as well.